Hello, welcome all coming on to the session 4 of Integrate CTO Academy. In this session, I will be discussing in brief about the coronary microcatheter that are commonly used because they have got a lot of use while we are doing the CTO PCIs. In CTO PCI, many times support is an issue, and in integrated wire escalation, many times we require a good backup support, and it comes in the form of a large guide catheter. Long sheaths can be used, dual lumen catheters, and anchor balloon technique, as well as guide catheter extension used. And out of these, most important is the microcatheter. So they provide not only the this lateral support as well as they help in negotiating the this channels or retrograde septal collateral channel dilators, like in the form of Corsair Pro Access is available. So there are a lot of microcatheters available, but I would be focusing mainly on the most commonly used microcatheter, that is Fine Cross, Caravel, and Corsair Pro Access, especially. So fine cross is one of the most common used microcatheter, and it has got a stainless steel bearing with a gold marker, which is radio opaque tip, and the tip entry profile is 1.8 French, and proximal shaft is 2.6 French. It has got a hydrophilic coating, and the inner lining is PTFE lining, and it comes in the two usable length, that is 130 centimeter for antegrade approach and 150 centimeter for the retrograde approach. And this is one of the most commonly used microcatheter. And again, this has got a tapered non-tape. It has got a tubular non-tapered tip, and it is best having a good lumen. It is best for tipping as well as rendezvous technique that I've discussed in the Retrograde CTO Academy. Although it provides a low active backup and it has a less support, that it is not a first choice for the complex CTO or calcified CTO, because it is not going to give that active backup or lateral support. Out of this, it has a distal 13 centimeter, which is having a easy advancement and access through the channels. It can be used sometimes in tortuous distal as well as epicardial collaterals, because it is less prone causing damage to the collateral. So this is the case in which the fine cross catheter was used in the integrated approach. Now, next comes the Caravel microcatheter. It is also having a braided shaft. It has an Act 1 precision braiding. Entry profile is much better as compared to the fine cross, that is 1.4 French. Although the proximal shaft is almost similar to 0.6 French. It has also got a hydrophilic coating, and that is 70 centimeter in 135 centimeter length and 85 centimeter in 150 centimeter length. And usable length for integrated approach is this 135 as compared to the 150 centimeter for the retrograde. So for retrograde arm gear, we should use a longer stent microcatheter. So this has this Caravel has a special characteristic like 1.4 French tip entry profile. Outer diameter of the distal shaft is 1.9 French, and proximal is similar to the fan that is 2.6 French. It has a hydrophilic coating of 70 and 85 centimeter in 135 and 150 centimeter respectively. It is both useful for antegrade as well as the retrograde approaches, and it can be used in both septal as well as the epicardial vessels. And it is a very safe microcatheter and can be used for the epicardial collateral CC1 collaterals. And it can be slightly rotated, although it is not meant as a channel dilator, but it can be sometimes rotated, but less than 360 degree in one direction. And what is important is it having an Act 1 precision braiding, and that provide its resistance to the kinking in the tortuous anatomy, especially when we are going with the epicardial collaterals. And two Cavroval catheters fit in a 6 French guide, and while doing the IVUS, it can be used with the IVUS catheter in a 7 French guide. So this is the case where we can see we tried the Australides CTU, but it is Australides calcified CTU, and it is filling retrogradely with the collaterals from epicardial collateral from the OM. So in this, we can see this microcatheter Caravel is seen in this view, and we negotiated it across this tortuous collaterals, and with the knuckle wire technique, knuckle cut, we were able to successfully open this CTU by epicardial collateral ipsilateral. So this Caravel is very useful, especially in the setting of the this epicardial collaterals. So this is what the end result of that LED CTO was. And we could see there is a epicardial collateral we can see in the last channel. So this was a connection between the OM and the distal LED. And through this Carabel catheter helped. And one of the very important microcatheter that we often use is Corsair Pro XS. Initially, Corsair was developed, then came the Corsair Pro, and the latest one is the Corsair Pro XS, and it is one of the most useful microcatheter, I should say, because it can be used in both most of the complex situations. And we can see it has a purple, this hub, which has some spiral appearance. So this differentiated from the various microcatheter, and it is used in complex PCI in very tight and calcific lesion, as well as it is useful in crossing the CTU boarding by rotation, and we should rotate in one direction 10 turns, and then we can move it to the clock or anti-clock to the opposite direction, 10 rotation further, and with the left hand we keep on pushing the tip of the microcatheter. And a Corsair Pro XS 2 can come in the 7 French guide, or along with the IVAS, it can come in the 8 French guide. So it is one of the most common used microcatheter nowadays, and there's a bit different among these in as compared to, and I should say this has the smallest tip profile, that is 1.3 French, although the proximal segment is having this profile as 2.9 French, but the distal tip is 1.3 French, and it is different from Corsair Pro. Corsair Pro XS has a this distal shaft profile of 2.1 as compared to the 2.6 French in case of Corsair Pro. So it can be, it is a more of a tapering, and it can be very well negotiated across a septal collateral. It act also like a channel dilator. So just summarizing this Corsair Pro XS, it has a tip entry profile of 1.3 French. So out of this fine cross, Caravelle and Corsair Pro XS, Corsair Pro XS has got the thinnest profile, that is 1.3 French. Distal shaft is 2.1 French and proximal shaft is 2.9 French, although it is a bit zero point 0.3 French higher as compared to the fine cross, of course, this Caravelle. But the most important is the tip entry profile, it is 1.3 French, and this can come along with the IVAS catheter in 8 French guide. And this is stainless steel Act 1 shaft, which has a 14 wires. This is present in this, and this gives it strength as well as rotational properties. So this Corsair Pro XS has a hydrophilic coating of 70 centimeter and 85 centimeter in 135 and 150 centimeter respectively. The longer one is used for the retrograde approach. And the more important thing is the rotation. If we are across a septal channel, then the collateral, then we can to make we can move it till the maximum place it goes. And if it stops, then we need to rotate in one direction while the clockwise. And once the 10 rotations are up, then we can, of course, change in to the different direction, going the from clockwise to the anti-clockwise. And this is the one microcatheter which can be, of course, used in a very complex CTO, especially calcified ones. And it has got a tapered soft tungsten marker, that is, it has a polyurethane low profile tip. So it gives a radiopacity as well as the negotiating power to the microcatheter. And this is one of the most commonly used microcatheter, especially for septal. So this is the case where ostial RCA CTO was a failed CTO elsewhere. And from LAD, we can see a good CC2 collateral, septal collateral are going to the distal RCA, PD connection there. So we took a Sion wire. Over this, we can see we took a Corsair Pro Access microcatheter because we knew that this will help as a channel dilator as well as it will can be negotiated across the septal collateral. So this is how this microcatheter was taken through the septal collateral, and it reached the distal RCA, but there was some bend. So at this place, we have to give some this clockwise 10 turns and anti-clockwise, and it was gradually moved to the mid of the RCA, and after that intracoronary tip-in was done, and the PCI was done successfully of the RCA. So this was the end result after. So this is how we discuss the judicious use of the fine cross, Caravel, and this Corsair Pro XS. So these are one of the most common microcatheters that are available nowadays, and they have led to a more increased success of the this CTO PCIs. Either it may be antegrade or retrograde. So we have to keep in mind in which case which microcatheter to take, and that is going to help us very much. So thank you all for patient listening, and we'll be discussing the next topic in the coming next session. Thank you.